Welcome to my channel Medicine Guide. Levothyroxine Eltroxin. Levothyroxine is a medicine used to treat an underactive thyroid gland, hypothyroidism. The thyroid gland makes thyroid hormones which help to control energy levels and growth. Levothyroxine is taken to replace the missing thyroid hormone thyroxine. Levothyroxine is only available on prescription. It comes as tablets or as a liquid that you swallow. Levothyroxine is a synthetic version of a hormone called thyroxine. It replaces thyroxine if your thyroid gland cannot produce it and prevents the symptoms of hypothyroidism. Levothyroxine starts working straight away, but it may be several weeks before your symptoms start to improve. The most common side effects of levothyroxine are caused by taking a bigger dose than you need. Your doctor can lower your dose to help reduce any side effects. Before you start taking levothyroxine, your doctor will do a blood test. Once you start taking the medicine, you'll have regular blood tests to see how well it's working. Levothyroxine doses need to be carefully monitored during pregnancy. If you're planning to become pregnant or think you may be pregnant, it's important to talk to your doctor to get the right care for you and your baby. In this video, we will discuss about levothyroxine safety and pharmacology, like its side effects, precautions, warnings, dosage. So let's start our discussion. But before that, please subscribe to my channel Medicine Guide. Now let's start with warnings or precautions. Warnings. Levothyroxine can be taken by most adults and children. However, it's not suitable for some people. Check with your doctor before taking levothyroxine if you have ever had an allergic reaction to levothyroxine or any other medicine. You have an overactive thyroid that produces too much thyroid hormone, thyrotoxicosis. Have a health problem that affects your adrenal glands. Your doctor will be able to tell you if you're not sure. Have a heart problem including angina, heart disease or heart failure. Have high blood pressure. Have ever had a heart attack. Have diabetes. The dose of your diabetes medicine may need to change because levothyroxine can raise blood sugar levels. Doses. Take levothyroxine once a day in the morning, ideally at least 30 minutes before having breakfast or a drink containing caffeine, like tea or coffee. Food and caffeinated drinks can both stop your body taking in levothyroxine properly, so it does not work as well. If you stop taking levothyroxine, your symptoms are likely to come back. Dosage and strength. The dose of levothyroxine varies from person to person. You may need to take several different tablets to make up your dose. Your doctor will tell you how many tablets to take each day. Levothyroxine comes in 12.5 microgram, 25 microgram, 50 microgram, 75 microgram and 100 microgram tablets. If you're taking levothyroxine as a liquid, 5 milliliters can have 25 micrograms, 50 micrograms, 100 micrograms or 125 micrograms in it. Although starting doses are usually the same, the dose of levothyroxine you end up taking, or how quickly the dose is increased, depends on your symptoms, hormone levels, age and whether you have any other health problems. Adults usually start with a dose between 50 micrograms and 100 micrograms taken once a day. This may be increased gradually over a few weeks to between 100 micrograms and 200 micrograms taken once a day. Some people, such as over 50s or people with heart disease, may start on a lower dose. If you or your child are taking levothyroxine as a liquid, it will usually come with a plastic syringe or spoon to help you measure out the right dose. If you take too much, taking more than your prescribed dose of levothyroxine can give you symptoms such as a racing heartbeat, palpitations. Blood monitoring. Your doctor will do regular blood tests to check the levels of thyroid hormones in your body before and after starting levothyroxine. These will allow your doctor to adjust the dose to suit you. At the start of treatment, you can expect to have blood tests quite often, but once your hormone levels are stable and your symptoms are under control, your levels will usually be checked once a year. You may need blood tests more often if you are pregnant. Start or stop a medicine that can affect the way levothyroxine works. Have any symptoms that could mean your dose is not quite right. Common side effects. The common side effects of levothyroxine usually happen because the dose you're taking is more than you need. These side effects usually go away after you go on to a lower dose of levothyroxine or stop treatment. Common side effects are the same as the symptoms of an overactive thyroid. There are things you can do to help cope with them. Feeling sick, nausea, being sick, vomiting, diarrhea, headaches, feeling restless or excitable, or problems sleeping, flushing or sweating, muscle cramps, shaking, usually of the hands. Talk to your doctor or pharmacist if these side effects bother you or do not go away. Serious side effects. It happens rarely, but some people may have serious side effects when taking levothyroxine. Tell your doctor if you get fast or irregular heartbeats, palpitations, serious allergic reaction. In rare cases, it's possible to have a serious allergic reaction, anaphylaxis, to levothyroxine. These are not all the side effects of levothyroxine. For a full list, see the leaflet inside your medicines packet. Pregnancy and breastfeeding. Levothyroxine in pregnancy. Levothyroxine is safe to take in pregnancy. It's important to carry on taking levothyroxine throughout your pregnancy. Having too low or too high levels of thyroid hormone in pregnancy can cause problems for you and your baby. You'll need to have regular blood tests during pregnancy to make sure you're on the right dose of levothyroxine. Your doctor may need to increase your dose of levothyroxine while you're pregnant. Levothyroxine in breastfeeding. It's okay to breastfeed while you're on levothyroxine. Thyroid hormones are a normal part of breast milk. When taken as a supplement, they only pass into breast milk in tiny amounts that are too small to affect your baby. If you're breastfeeding, it's important that you continue to take levothyroxine, as this is replacing what your body would normally be making. Your body needs good levels of thyroid hormones to make enough breast milk for your baby. If you notice that your baby is not feeding as well as usual, or if you have any other concerns about your baby, talk to your midwife, health visitor, pharmacist or doctor as soon as possible. That's a no for this video. If you want to watch more videos like this, keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine God.